of India, Uttar Pradesh chapter. We've had great academic deliberations yesterday, followed by the wild evening. And this morning we start the proceedings with the quiz. The first round of 15 minutes would be for the DM residents, and the last round of 15 minutes would be for the technicians. Without any further time, I'd like to invite Dr. Gaurav Chaudhary, Additional Professor, Department of Cardiology at Lari Cardiology Center, King George's Medical University, and Honorary Editor of the Journal of Cardiological Society of India, Uttar Pradesh chapter, and Associate Editor of the Indian Heart Journal's case reports, to please take over the proceedings. Dr. Chaudhary, please.
Morning to all of you. So I hope we have resident from KGMU, SGPGI, RML, and any other institute? LPS. So it's more of a, what do you say, spotters. It's almost your, whatever slides you can see in your DM exit exam. So we are not having that proper quiz team-wise because we are short of time. So I hope this can be of some use to you in your coming exam. So we would have 15 minutes and we have 20 slides. So you can write down your name in capital letter and institute, and 1 to 20 you can take the numbers, and whatever is being asked you have to write the answer, and later on we'll check, and by the end of the today's session we'll announce first and second winner, and we have a award as well as medals for them. So I think we are just at 8:30 and almost everyone has come, so I'm starting. So what is the spot diagnosis of this X-ray? Kindly you have to do it individually, please. Last, you will have to do it individually. It's an individual quiz. It's not a college quiz or a team quiz. It's an individual effort. So I think it would be better if you answer it by your own, because otherwise one may be having more marks or other having the lesser marks. The team from LPS, please you be seated one seat apart. So hope it's a spot diagnosis, and often you can be shown this X-ray in your exam. So coming on to the next slide. What is the diagnosis from this cath study? Moving on to the third slide. What is the diagnosis? It's a congenital anomaly, that I can say. Coming on to the fourth X-ray. It is again a congenital anomaly. What is the spot diagnosis? Coming on to the next vignette, what does this trace indicate? And, kindly do not see every question to be, with the lens that every question is going to be very difficult, because I've tried to kept 30-40% of the slides to be very simple, so that because many times you are being given these simple things in your exam and we often think of only syndromic things. So just analyze and give the nearest answer, whatever you can give. Coming on to the next slide, what is the diagnosis from the pressure tracing below? Coming on to next, 25-year-old female with primary amenorrhea and hypertension, interpret this tracing. What is the diagnosis? Cardiac diagnosis. Sorry. "20-year-old male with recurrent palpitations, shortness of breath for last 4 years. Came with this tachycardia. He was given some therapy and second ECGs after the pharmacotherapy or pharmacoconversion. Please do not discuss among themselves. It's an individual effort because it's more like an exam. Individual approach should be, yes, you have to write the diagnosis. Not of ECG, you have to write the diagnosis of the patient, what you expect. ECG you can make out what is going on, but what with the basal diagnosis of the patient. So this is a patient who received multimodality treatment. You see so many things in this picture. He has received lot of implants. Almost most of the cardiothoracic procedures have been done. But you have to answer where this yellow arrow is pointing. What is this procedure being done? What is this? Coming on to the next slide, 39-year-old diabetic, hypertensive, hypothyroid female presented with almost normal looking angiogram, that is elevated troponin, what we call MENOCA. So I would just like you to make what is the OCT image showing here. These images that I will show are from our own patients, so the basic of imaging is keep it simple. So first you should try to identify the very simple structures and you should see what you want to see, not everything in the image. What information you want to obtain should be seen, because there are lots of numerous findings which we keep on pondering, but I think you should focus on the major findings. Coming on to the next slide. I'll not give the history of the patient, but what do you see on this OCT? What is the OCT diagnosis? If you find this on an OCT pullback. This was one of the pullback done during the COVID pandemic, although not related to this pandemic, anything. But interestingly, this was a post-COVID patient. No, but nothing to do with the diagnosis. So do not get confused that it is to do something with COVID. It is the normal OCT finding that you can see once you are doing the OCT in various angiograms that you see. Coming on to the next. So this is OCT of our own patient who had ACS, and this is clearly showing a flap-like structure. So this is, I'm telling you, this is intimal dissection. But what I want to ask is this red arrow, what this red arrow is pointing. Some structure you can see. So what is this actually red arrow which is pointing? Because you can identify lots of structures that cannot be seen by IVUS, by OCT, you can quantify and you can see lots of things. Coming to the 13th question. So clinical history, this patient is a post PCI case with a third generation stent implanted 1 year back. So what is the spot diagnosis from OCT? Post PCI setting, third generation stent implanted. In center you can see the catheter, and rest you have to answer what is the diagnosis. So this is again angiogram taken, after that OCT pullback taken. So from 3 o'clock to 9 o'clock you see some structure there. Again, I would like to say we are dealing with the basics. We are not going for the very hi-fi things, because even if you are able to understand the basics of imaging, then that is the most important thing. So what this structure, red arrow, from 5 o'clock to 8 o'clock you can see. Please do not discuss. It's not a teamwork, again I would say, although you can discuss, but I think you can discuss it afterwards. We can give it to you all if you want after the quiz. It can be emailed to you. So again, coming from OCT to IVUS, we have a lot of OCT. Now coming to the IVUS. So it's again a classical picture that you often see once you started doing IVUS imaging. So what is the most important finding in this image? Coming to the next slide. What procedure is being done here? So we all are aware that statins have changed the medical history, natural history of our CAD patients. Sorry. I think please extend it by 5 minutes because for technician we have just 5 minutes. So coming to this question back, who is this great person who was the main instrumental behind the development of statins? He is from Japan, although he has not received Nobel Prize, but I think he has done work at par with so many other scientists 50 years, 40, 50 years down the line. So we should know him at least. He invented all these statins, initial statins. So we, Lord, I think millions, billions of people have been using aspirin. So these are some trees from which we have got this. These are the main basic medicine that we are using, statins and aspirin. So I think we should have some insight that where do they come from. Coming to the next question. Again, statins, we all are using right and left, but there are some fungus that was used and from where it was extracted 40 years back. And coming to the last question, it's recently we have read somewhere in newspaper or scientific papers or journals that we have got a xenotransplant. So we all are aware about who has done the first cardiac transplant. So just a question, just to incite some interest into this topic, because in this pig gene editing was done by CRISPR technique. CRISPR techniques were also given the Nobel Prize in 2020. So two doctors, two surgeons from US were instrumental in it. So if you can name them. Although unfortunately the patient had died after 3 months of the procedure. And it was done 30 years back by Dr. Barua in India. For that he was jailed for 40 days. But now the story has come again to the xenotransplant, and pigs are being edited by CRISPR technique. So who has done this work? So I think we can end with this question, and you can see that you have written your name, your institute. Institutes and many private centers now using intravascular imaging. So before starting the procedure, there are some machines where you are asked to do some maneuver to reduce this artifact. जो आईवस की मशीन है उसमें सब जगह यूज़ कर रहे हैं हम लोग, उसमें कई बार हम लोग बोलते हैं कि भाई आईवस लग रहा है इस पेशेंट में, अब आप देखिए कि इसमें कैसे कुछ आर्टिफैक्ट दिख रहा है, इसको हटाइए. पहले में दिख रहा है, दूसरे में उसको नलीफाई किया गया है. इस आर्टिफैक्ट को क्या बोलते हैं? यू कैन राइट as question 1 and you can write the answer. ये कुछ मशीन में जरूरत नहीं पड़ती है, बट दो तीन टाइप की मशीन्स हैं, कुछ मशीनों में जरूरत अब नहीं पड़ती है, बट फिर भी कुछ में पड़ती है. तो क्या ये किया गया है इसमें, ये बताना है आपको. आपस में डिस्कस नहीं करिए क्योंकि इसमें फर्स्ट और सेकंड प्राइज जो है वो इंडिविजुअल एफर्ट है, इट इज़ नॉट अ टीम एफर्ट. सेकंड क्वेश्चन, ये फिर से आईवस की इमेज दिखाई हमने, इंट्रावेस्कुलर अल्ट्रासाउंड. इसमें बीच में कैथेटर है और एक वाइट सा मून लाइक स्ट्रक्चर दिख रहा है. तो ये स्ट्रक्चर क्या हो सकता है? ऐसे पेशेंट्स में डिफ़िकल्टी आती है, फिर और इंस्ट्रूमेंट यूज़ करने पड़ते हैं सक्सेसफुल प्रोसीजर के लिए। सो व्हाट इज़ द स्ट्रक्चर, क्या लग रहा है आपको ये? Kindly please do not discuss. You can discuss after 5-10 minutes. It's just a learning exercise. It's nothing coming first or second. It's just inciting the interest as well as increasing our knowledge. Coming to third question. ये मैंने इससे पहले रेजिडेंट में भी इसको दिखाया, बट अब मार्कर चेंज कर दिया है। अब इसमें इस पेशेंट के काफ़ी प्रोसीजर हुए हैं, कुछ मैं बता देता हूँ। वॉल पड़ा है, टाबी भी हुआ है, स्टर्नम के वायर्स भी दिख रहे हैं, बट जो बीच में कैप्सूल जैसी चीज़ दिख रही है जिस पे एरो लग रहा है, येलो एरो लग रहा है, तो ये क्या चीज़ है, क्या हो सकता है? सारे प्रोसीजर इसको लगभग हो चुके हैं। टोटल 10 क्वेश्चंस हैं, 3 क्वेश्चन हमने डिस्कस कर लिए हैं, अब हम फोर्थ पे आ रहे हैं। काफ़ी सेंटर्स पे ओसीटी अब अधिकतर सेंटर्स पे यूज़ हो रहा है, तो मैनी टाइम्स आप कंट्रास्ट यूज़ करते हैं, डाई यूज़ करते हैं, बट अब जो ओमनी पैक और विजी पैक आप यूज़ करते हैं, इसके अलावा भी और सॉल्यूशंस हैं, स्पेशली जिनको रीनल फेलियर है। तो क्या और सॉल्यूशन है जो हम यूज़ कर सकते हैं? वैसे 3 हैं, आप कोई भी एक नाम बता सकते हैं उसमें। What is the other solution other than contrast dye which can be used to do OCT in patients, especially patients who have a borderline renal functions? There are 3 other solutions, you can name one. Coming on to the 5th question. इससे मिलता जुलता अभी हमने रेजिडेंट वाली क्विज में भी दिखाया, बट इसमें ये OCT हो रहा है पेशेंट का, हमारे ही एक डिपार्टमेंट में किया गया है। हार्ट अटैक MI करके पेशेंट आया है, उसका OCT किया गया है। अब इस OCT में बीच में कैथेटर है, उसके बगल में जो येलो एक डॉट है 2 o'clock से लेके 5 o'clock तक, तो ये क्या हुआ है, इसको क्या प्रॉब्लम हुई होगी जिसकी वजह से इसको हार्ट अटैक हुआ है? ये OCT की इमेज है, इसमें आइडेंटिफाई करना होगा हमें कि इसको जो हार्ट अटैक हुआ उसका कारण क्या लग रहा है। तो OCT हेल्प कर सकता है हमें। वेस्ट में, US, यूरोप में अधिकतर इमेज का एनालिसिस 90% टाइम चीफ टेक्नोलॉजिस्ट जो लैब में होते हैं वो करते हैं। तो ये नहीं सोचना है कि हमें पता नहीं क्या दिखा दिया। डू नॉट थिंक लाइक दैट। इन वेस्ट इट इज़ द technician, technologist who is doing intravascular, the consultant who are doing live cases ask the findings from the chief technologist present there. तो ये नहीं सोचना है कि तो हम नहीं करते हैं, हमसे क्या मतलब। I think every institute has it and the technologist should also know. ये किसी को स्टेंट लगा है कुछ साल पहले, अब उसका OCT हुआ है, तो इसके बाहर जो एक सूर्य और उसके चारों तरफ रेखाएं दिख रही हैं, वो तो स्टेंट की स्ट्रट्स हैं, ये मैं बता सकता हूँ। इसके अंदर क्या है, स्टेंट के अंदर क्या हो गया? ये स्टेंट लगाया 2-3 साल पहले, पेशेंट चेस्ट पेन करके आया, आपने एंजियोग्राफी करी, फिर डॉक्टर गौरव ने कहा OCT चलाओ। अब OCT चलाने के बाद क्या मिला, क्यों चलाया गया, पता नहीं क्यों चलाया। So what is the diagnosis of a post angioplasty patient? जिन सेंटर पे OCT नहीं हो रहा है तो वो अलग बात है, बट काफ़ी सेंटर्स पे, मेन इंस्टीट्यूट्स में, लखनऊ में 3 इंस्टीट्यूट में तो है ही इस समय, और तीनों जगह हो रहा है। ठीक है, अब नेक्स्ट क्वेश्चन ये है, रोटाब्लेशन बहुत यूज़ होता है आजकल, कैल्शियम आ गया, रोटाब्लेशन हो गया यूज़। अब कोरोनरी के अंदर आप चले गए, रोटाब्लेशन हो गया। इन विच मोड रोटाब्लेशन बर इज़ विदड्रॉन? जब रोटाब्लेशन प्रोसीजर हो जाता है उसके बाद जब बर बाहर आती है तो उसको एक पर्टिकुलर कोई मोड बोलते हैं हम, कि इस मोड पे निकालेंगे अब हम उसको बाहर कोरोनरी आर्टरी के। तो उस मोड का नाम क्या है? उसमें स्पीड थोड़ी कम हो जाती है, ये आपको पता ही है, लेकिन इस मोड को क्या बोलते हैं? नेक्स्ट क्वेश्चन। अब आजकल पेसिंग भी है, बहुत टाइप की होने लगी हैं। सिंगल डुअल चैम्बर तो होता ही था, सीआरटी भी होता था, अब ये नई टाइप की पेसिंग शुरू हो गई है। ये जो लीड पड़ी हुई है ये कहाँ जा रही है और किस टाइप की ये पेसिंग हो रही है, क्या पेसिंग इसको बोलते हैं। सेप्टम तो लिखा ही है ग्रीन, उससे वो मत लिखिएगा आंसर। सेप्टम में ही है, मतलब दो टाइप की पेसिंग होती है, उनमें से कोई भी आप नाम बता देंगे तो आंसर वुड बी मार्क्ड एज करेक्ट। दो टाइप की नई पेसिंग साइट आ गई हैं, एक्सेप्टेबल है, साइंटिफिक एविडेंस है, पेशेंट के लिए बेटर है। अभी एक कैल्शियम की बहुत बात होती रहती है, अब रोटाब्लेशन होता ही काफ़ी सेंटर्स पे, अब नई एक और टेक्निक आ गई जो इसमें की जा रही है, जो हम लोगों ने किया है। एक बैलून दिख रहा है, आंसर अगर किसी को पता है तो प्लीज़ उसमें लिखें, उससे उन्हीं को प्राइज़ मिल सकता है, ऐसे सबको बताएंगे तो उनका प्राइज़ हो सकता है ना मिले। कॉमनली यूज़ हो रहा है, सभी सेंटर्स पे हो रहा है, गवर्नमेंट प्राइवेट इंस्टीट्यूट सभी जगह हो रहा है आजकल ये, और अच्छी टेक्निक है। आई थिंक कमिंग टू द लास्ट क्वेश्चन, कैथ लैब में कई बार हेपेरिन को रिवर्स करना पड़ता है, सो व्हाट इज दैट थिंग। हेपेरिन के एक्शन को रिवर्स करने के लिए क्या देना पड़ता है। आई थिंक इट इज 9 o'clock, so Abid, you can collect the answer sheets. I think thank you all for patient listening. So we come to the end of the
That very